When there is an issue affecting the care of patients, as nurses, we're trusted to be there and to speak out and advocate so that our patients can get the best care. It's why everyone loves nurses, except when we have to give you a shot. Today we're here to discuss a healthcare emergency that has developed here in Pennsylvania, or in medical terms we're calling a Code Blue. When folks get sick or someone in their family becomes ill, they expect that they're going to get the best care. And they assume that there's going to be a safe level of nurses staffed to take care of them until they get better. We're learning that in Pennsylvania hospitals, all too often, even an adequate level of nurse staffing isn't available to our patients. And without a system in place, there's no reason to think that statewide it's going to get any better. The research is showing that when there is an inadequate level of nurse staffing, accidents and medical errors are more likely to occur. Patients are more likely to develop new problems than what they came in with. Patients are going to take longer to get better, and shockingly, our patients are more likely to die. We know now that the fact that unsafe nursing staffing levels creates a hazardous environment that jeopardizes the safety of all patients, including our children and the elderly. Here are 3 facts to consider. Number 1, dying from surgery is over 60% more likely if you have that surgery in a hospital where there is an unsafe level of nurse staffing. 60% more common. Second, nurses in Pennsylvania are telling us, nearly 3/4 of nurses surveyed, that inadequate nursing staffing impairs their ability to take care of their patients on a daily or weekly basis. And last, in 2014 alone, in Pennsylvania, there were nearly 250,000 avoidable serious events or near misses, and that's unexpected death or events requiring life-saving or major medical intervention that were reported by hospitals. Nearly 250,000 avoidable. As a clinician, this is a situation that we face in Pennsylvania, and that's why we're calling it Code Blue. I'd like to turn it over to Betsy Snook, a registered nurse and the CEO of the Pennsylvania State Nurses Association, to talk more about the facts and the impact of unsafe staffing. Betsy?
Thanks, Tarek. I don't know if you heard that number, but the actual number is 240,778 serious events or near misses, incidents we call them, here in Pennsylvania alone. That's a significant number. 240,778 serious events or incidents that have occurred in this state alone. Now, there's some good news, and you're going to hear some of the good news today. The good news is, are we getting better at lowering that number? We are, but good is not good enough, is it? If you still have 240,778 medical errors or near misses every year, that's not good enough. You don't go into the hospital, do you, expecting that you'll have some type of serious incident or complication. And we know that 10,000 complications happen every day in this country. And we cannot talk about these errors and patient safety unless we directly talk about nurse staffing. Let's talk a little bit about what that means to the nurses, who are our surveillance systems, who watch for their patients every day, who advocate for them every day. Let's talk about their story. I'm going to share with you 3 stories today from nurses, and I'm telling you these stories word for word, with their permission, from nurses who would not permit us to use their actual voices for fear of retribution from their organizations. Because the reality of this is, we don't like to talk about medical errors, but the reality is it happens, and it happens every day. So let me tell you about these stories. I'm going to read them for you, forgive me. These are actual word for word. We surveyed over 1,400 nurses in southwestern Pennsylvania, and these are some of their stories. If you are a patient or have ever been a patient, or you have a family member who's a patient or who has ever been a patient, these should be meaningful for you to hear. Hello, I work at a level 1 trauma center in Pittsburgh, Pennsylvania. I work every day short-staffed. It is amazing that an institution that can do world-class medicine can't figure out how to manage the schedule and fill in vacancies in a short time. It appears to me this is on purpose. I mean, there's texting, emails on your phone, all kinds of ways to alert people to come to work. I work with incredibly motivated groups of nurses in the emergency room, and all of us feel a sense of responsibility to help our coworkers. Nurses feel this responsibility. As a surveillance system for the hospital and advocates for our patients, we feel this responsibility every day. Another nurse wrote to us, "I can remember working on a rehab one night on night shift. I had 18 patients for just me, the nurse, and 2 nursing assistants. I remember being scared because I knew I was responsible for all 18 patients, and I didn't think we could do it. I told the management that came up that night, and I felt like there was impending doom. And he told me to do the best I could. That night, a craniotomy patient fell out of bed. I felt awful because we just couldn't round as often as we needed to. We are not supported. I called the on-call supervisor, and he was annoyed that I called him, more annoyed that I called him than caring for the patient who had fallen. And finally, when I started in the hospital, staffing was better. Now it's poor. We had moms in labor who are on certain medication, and it used to be that we only had 1 patient. Now I can have moms on medications with 2 and 3 additional patients. We used to always have an RN in the nursery with the babies, and now there are times when the secretary is watching the nursery. It is very unsafe. I can tell you that this is only these are only 3 of many stories we heard from nurses about their caring for these patients and their concern every day that they're putting their patients at risk. We know that preventable medical errors are the 3rd leading cause of death in this country. It is time to do something about it. It's why we've called a Code Blue today. We've called a Code Blue because it's time for patients and their families to join us in a dialogue to discuss how we're going to solve this problem. How are we going to decrease those medical errors? What does it look like in your hospital? That's what it looks like for a nurse on a daily basis, but what does it look like for the patient? Well, it might mean their call light doesn't get answered in due time. It might mean they don't see a registered nurse who can help them with their plan of care. It might mean their medications and their treatments don't get done on time. That's what it looks like to a patient. And unfortunately, all too often, they think that's normal now. We know that the nurses are working as hard as they can. They're working long hours. And what does this cause? It causes fatigue. And we know that the 2 major reasons for chronic fatigue among nurses are insufficient staffing and poor work environments. And unfortunately today, our nurses, most of our nurses are in those situations. We know that this fatigue will lead to burnout, it will lead to higher turnover rates, it will lead to inconsistency in patient care, and it will lead to medical errors. That's why we're here today. We're here to advocate for our patients as we've done all of our careers, and we're here to advocate for those who care for our patients. But you know, it's not just the nurses that are worried and concerned about this situation. We are fortunate to have a champion in our legislature, Representative Maury Gingrich, who has been attentive not only to the nurses, but more importantly to our patients and the patients we care for. And Representative Gingrich has championed a solution that I'd like her to share with you today that can result not only in better outcomes for our patients, but a reduction in medical errors. Representative Gingrich.
Thank you so much, Betsy. I'm honored to be part of the treatment if not the cure, for the code blue issue that we're talking about today. And it definitely is a code blue issue. It's critically important. What could be more important than the direct connection between the quality and the quantity of high-level medical care in our hospital situations by our nurses? What can we do to treat what we've heard? And some of it, I must say, is horrifying. And every time I hear it, I'm more and more surprised. And we're going to address that, hopefully, in House Bill 476, so you won't need to be concerned about expressing whatever issues you might be dealing with in your hospital. And granted, many hospitals are doing a fine job with staffing decisions that they make. But what's critical is that we have it happening everywhere and every time for a patient-focused safety perspective. Thus, the bill that creates a commission that is comprised of all the right people, in my estimation, we're talking about making these decisions between administration and the bedside nurse representation on the forefront, and not dealing with being short-staffed, not dealing with dangerous situations. If we are successful in bringing this particular bill and this creation of the safe staffing process, we won't have to deal with the issues that we're talking about today, certainly not in the level that we have. There is nothing more important than making good decisions on staffing. We've worked on the bill. This bill was not my own brainchild. It's been worked on for 6 years. Now, nothing moves fast here. So in code blue terms, I'm afraid of who we would have lost in that element of time. But we've stayed focused. We've moved forward on it. In fact, a couple of my colleagues are here today. One I know because she's an RN, and I know that she will support the improvement that we need. And also is one of our leadership team, whom I have a great deal of respect for, and that's our Appropriations Chair, Bill Adolph, who really worked this concept before I took it over as a bill. So we've got a lot of support for this bill and the difference that it's going to make for hospitals, for nurses, and most especially for patients. We have a lot of support among my colleagues, and we're in a process that takes your voice. It's going to need the volume of nursing professionals that are out there talking to their legislators to co-join with me and the others that are already co-sponsors, and there's a very good number that are. We want to get this done for you, for the patients, for all of us, every one of us that a loved one or even ourselves will be in and out of a hospital. And hopefully we're coming out well, not being concerned about an immediate readmission because the care hasn't been adequate. We can solve a lot of those problems by getting the right people at the decision-making table up front. That's where we're going as part of the treatment, and hopefully in the end we get to 0 readmissions, 0 complications, and we can all feel a very positive part of that process. So while I'm not a medical professional, I'm happy to wear the code blue sign. It is a code blue emergency, and it's going to take all of us and the continued work we're doing to get to 0, and that's where we're headed. Thank you. And I'd like to hear now from the president, the current president of PSNA, and that's Dr. Chris Alekny.
Thank you, Representative. Well, it is my responsibility to summarize what you have heard today. And I have to first thank again the other representatives that are here among our midst. Besides Representative Judy Ward and Representative Billy Adolph, Representative Ted Nesbitt is also with us today, so we thank them for their support of this legislation. But the PSNA, Pennsylvania State Nurses Association, in this briefing session really is looking at the heart of the matter. Who is at the center of every decision that nurses make? It's the patient. It's their family. That's what the term patient-centered care is all about. So without any issues, we're looking at the impact that if you remove what is best for the patient, outcomes are disastrous. And as Betsy has stated, the number 240,778 serious events or incidences have occurred in the past year. That's too many. We're hoping for a zero medical error tolerance. That's an audacious goal, but actually when you bring your loved one into a hospital situation, you do want them to be well. And the nurses are their advocates. Now, who are we? Well, if you look behind me, our nurses come from across the whole entire state. Every region, from the Northwest and the Southwest to the North Central, Northeast Pennsylvania, South Central, and Southeast, all over. They represent all kinds of nursing, schools of nursing, directors of nursing, hospital administrators, etc. They're looking for, and staff nurses, they're looking for a solution. As the representative has so stated, it has taken us 7 years. If we work together, and we talk so many terms, collaborative relationships, collaborative partnerships, if we work together in good faith, nurses and hospital and nurse administrators are able to come up with a valid solution that is good for their patients in that particular facility. Not everything works, not one solution works for all. Likewise, we're looking at the well-being of our patients, and we know that the networks that surround nurses throughout the hospital, through our patients throughout their experiences, is a team. The physicians, the technicians, the nutritionists, even housekeepers, all make a healthy environment. So working together on House Bill 476 is important. That is also the reason why we declared a Code Blue emergencies on behalf of all of the patients and their families that we serve in the state. Likewise, we're hoping that the public becomes involved. This is what we are doing today, raising the public awareness of what is happening in the hospitals and their need to call their legislators, their hospital administrators, visit their physicians to talk about the staffing issues and to discuss as far as a collaborative approach in relationship to decreasing preventative errors in the facilities. We urge Pennsylvanians, the citizens of this great Commonwealth, to contact their lawmakers, to discuss the legislation and the well-being that needs to occur in hospitals to facilitate House Bill 476. We're hoping that it is passed and placed into law. So if you want to learn anything else about the legislation, House Bill 476, please contact Pennsylvania State Nurses Association or go on our website, psna.org. I'll repeat that, psna.org. And finally, I thank everyone for attending today, but we will also be willing to take questions from the credentialed media after the briefing. Thank you. Have a great day. And for our patients, please become involved and contact your legislators. Take care.
Thank you.
Go Nurses!